Bullying and harassment cost the UK National Health Service £3 billion every year, says Dr. Simon Fleming. Simon is a top 100 social media influencer in his industry. We met the public campaigner in London to talk about the benefits of diversity in surgical professions and his personal social media activities.
So Simon, thank you for taking the time to speak to us. I just attended a speech of you about diversity in orthopedics. Where do we stand in the 21st century on that topic?
That's a big question. I think the challenge we have is that we know that healthcare in particular should look like the society it serves, and it doesn't at the moment. Orthopedics and plastic surgery aren't particularly diverse. Things are better than they were, but there's a long way to go in terms of all those characteristics. So not just gender, but age, sex, sexuality, race and ethnicity, all those factors, disability, those are all things we're looking at now. And really we're in the very early stages of having those quite uncomfortable conversations about how we become more diverse as a community so that we can better serve our patients, get better outcomes, be more innovative. And those are all things that we know diversity can affect.
And what do you think are the biggest obstacles that we need to get out of the way to make the industry more diverse?
I think that the challenge when we talk about obstacles is that some of them are even more than systems obstacles. When we talk about hierarchy and patriarchy, or when we talk about power dynamics, it's about getting your head around the idea that healthcare as a profession came about from historically men who tended to be straight and who tended to be Caucasian building healthcare. And so all those systems that are in place, that are ingrained in how we do things, were designed to benefit those men, whether it's the pay structure, the working hours, how the teams are built. And so what we have to understand is that change is difficult, change is scary, change does mean loss for some people and compromise, and all of those things, all of those systems will need to change, as well as the kind of personal responsibilities we all have to be part of that.
This naturally raises the question of whether these changes in orthopedics will take decades or whether it's possible to accelerate the change. Here's Simon again.
It's nuanced, so you need both. So you need, if you look at there's change models and change management models, and we need those easy wins. We need those low-hanging fruit. But the classic example, if you think about it, is things like getting the world to stop smoking cessation. Getting people to actually cut down smoking took 30, 40, 50 years. It took legislation and law change. It took marketing and advertising. It took suddenly noticing that the hero in the film wasn't smoking anymore. It took noticing that the sports team weren't sponsored by cigarettes anymore. It was that poster here and that picture there. And that stuff took generations. On the other hand, there was some low-hanging fruit. So in the UK, we just banned it in pubs and restaurants. That was a law change. That happened overnight. That was a thing. And then, of course, we had to deal with the fallout from that, from the repercussions of that. So I think it's accepting that there's no one quick fix, that the real change that we would like to see will and must take time to be sustainable and meaningful. And also accepting that the change we're talking about is iterative. So when we talk about culture change, at the moment I feel like I'm at the cutting edge of culture change. I have to accept, if I have a growth mindset, that in 10 or 20 years' time, culture, the world, society will have moved on. And I either need to go, right, and I need to be ready to adapt for that, or I immediately become part of the problem. And so it's not just that it will take time, but that actually the work will never end.
So it is an endless story. It would probably be a bit faster if we can tell administration or the people sitting on the top of a hospital that diversity brings better results or saves money or whatever evidence. People that think numbers. What is your message to those people?
We know for a fact, Harvard Business Review and others have published on it, that if you are a diverse organization in terms of both characteristics and diversity of thought, you make more money. You make more money on a year-by-year basis. You also recruit and retain better people who stay. We know that you get better patient outcomes, both in terms of things you can measure, so PROMS scores and things, but also your patients are happier, your staff are happier. So whatever your motivation is, there's no real downside to diversity, except that you're going to have to put some effort in to get there. If you look at the flip side, we know that behaviours like bullying and harassment cost the NHS about £2.4 billion a year. So there's no logic to not challenge those behaviours and try and get rid of those.
And you're a straight white man, as you already explained, and you're the opposite of being a silent person. So we can follow you on Twitter, we can follow you on other social media. What's your motivation to be so active? So you're obviously not a digital native, but you're a digital maniac. What is your motivation that drives?
So I mean, without turning this into kind of family therapy, I grew up in a household where my father was a Holocaust survivor, and he would talk not often about the problem with these things that go on in the world is that no one does anything about them. And now there's something about what you permit, you promote. If you walk past something that you know fundamentally inside you is wrong, it goes against your core values, then you feel something. You feel shame or anger or guilt. The psychiatrists would call that moral injury. And what I realized is I was seeing all this stuff that just knew it wasn't right. And I didn't know what to do about it, so I started. And you mentioned, the digital platform. When I started this work in 2015 at a British Orthopedic Association conference, was when we launched kind of the culture change agenda, if you like, in this country at least. And there was no money, there was no team, there was a certain amount of will, but change takes time and money and resources and people. And what I realized is actually you can build a coalition of people through social media. You can use that platform to not only identify your community but build a new one. And social media has such a unique way of flattening the hierarchy that it allowed for some really difficult conversations to play out in a way that maybe they couldn't if you were face to face with someone or across a board table from them or on a podium.
And Simon, we're in a digital age. What is your message to colleagues who still watch TV on a television?
I guess to say that social media isn't as scary as people think it is.
Yeah.
I think if you're not sure how to do it, there will be someone around you who can help you. Because again, a bit like the diversity piece, what we now know is if you engage in social media, your impact factor in journals will go up. People will cite your papers more. People will come to your hospital and your clinic more. That it is now a fact of life. Most news organizations will post news on social media before they put it in their newspaper or on their TV channel. Social media is now what television or radio or the computer or the internet was in its era. It's not scary, it's just new. And if you can accept that it is a fact of modern healthcare and modern society, actually, like anything, like whether you watch 10 hours of TV a day or just 5 minutes of TV, you can then choose how much to engage with it or not. But to not engage with it at all is now akin to saying, I won't watch the news or listen to the radio at all. It's a choice, but it's maybe not the one I would make.
Good. Thank you very much for taking the time.
My pleasure.